Good morning. I'm Dr. Alaimo. Today we have Miss Kathy with us. And just tell me a little bit about what it is that you actually came to see us for here at the clinic.
I came because my husband initially wanted to come and get us 2 free visits, and I was very impressed with
For what condition?
inclusion body myositis.
And the diabetes is what
Right.
he originally came in for.
Right.
Right. And so you sat in on the consultation and it kind of made sense with what we were doing here.
Yes,
What do you do for a living?
I'm a respiratory therapist.
Okay, so you're in the medical field, so kind of what we say has to make sense because you have a lot of people around you, I guess, that are medically oriented, correct?
Right.
Okay, and what was your main concern or issues that you wanted us to help you with?
Bipolar. I wanted to come off of my meds.
Okay, so you were bipolar and you want to come off some of your medication.
Mhm.
We know that in the clinic what we basically do is we look at the overall physiology of whatever's ailing somebody and try to fix that or help to adjust that through diet, nutrition, and lifestyle changes. Now you've been with us a couple months, we just did some follow-up labs. Tell me what improvements you've noticed up to this point.
I have decreased my Klonopin. I have come off my blood pressure medicine. I have decreased my lithium.
Wow. And how's your sleep done?
Better.
Energy?
Better.
Mood?
Ask David.
Better?
I think so.
Yeah. And that's good. And obviously, I mean, after only a couple months, you've been on, how long have you been diagnosed with bipolar and how long have you been on meds for?
I've been diagnosed at age 40 and I'm 54.
Yeah, so for
Long
14
time.
years, after 2 months, you're getting some really good changes. I'm really happy about that.
Right.
And one of the biggest changes I know we made with you is that we did some extensive testing on you and we determined what exactly, what did we think was maybe one of the main triggers of what was causing some of your problems.
That I need to eat more.
So your blood sugar was dropping, right? What about food sensitivities?
Gluten.
Gluten. And I explained to you a lot of the stuff that we go over with gluten, and you know, there's a 3.2 times greater chance of developing schizophrenia and some of these other mind-altering conditions with patients that are just gluten sensitive. So how many people are out there suffering that, I don't want to say might just have a gluten sensitivity, but maybe if we get them off gluten and get their diets improved, maybe it can decrease some of their needs for medication.
Right.
Right? And again, we explained to you that overall our goal was not to decrease your medication or take you off medicine. Our overall goal is to improve your physiology so that you can decrease your medicine on your own as your symptoms decrease. Now, doesn't that make sense?
Yes.
Good. So we know that we have another couple months left of working with you, and I look forward to getting you stabilized and you know, again, not necessarily getting you off your medication, but improving your quality of life through, you know, diet, nutrition, and lifestyle change.
Right.
Make sense?
Makes sense.
Good. Okay. Thank you.
You're welcome.
Okay.